There are two types of murmur, systolic and diastolic murmur. Systolic murmur includes mitral regurgitation, mitral regurgitation best heard at apex of the heart, which is radiate to the axilla. Next is tricuspid regurgitation, which is radiate to the along the sternum of the sternal border. Aortic stenosis. This murmur is crescendo decrescendo type. And radiate to the carotid. Next murmur is pulmonary stenosis, best heard at the pulmonary area. Next is ventricular septal defect. This type is also a systolic murmur, and the other is mitral valve prolapse. Second classification is diastolic murmur. Diastolic murmur includes mitral stenosis, tricuspid stenosis, aortic regurgitation, and the pulmonic regurgitation. There are some key features of these murmurs that includes aortic regurgitation has wide pulse pressure, early diastolic murmur, and decrescendo in nature. Other is aortic stenosis that have narrow pulse pressure, decrescendo and crescendo murmur. Mitral stenosis have mid diastolic murmur, have opening snap. Mitral regurgitation. This type of murmur has blowing pansystolic character. Best heard at apex. Mitral valve prolapse. Mid systolic click. Thanks for watching.